Fertility Podcast has been sharing expert content and patient stories now for a whole decade. If this is your first listen, welcome. My name is Natalie Silverman and I launched the podcast once pregnant after ICSI treatment as I wanted to use my broadcasting background to lessen the taboo on this difficult topic. Whilst I spent the first year being anonymous, as my audience grew, so did I. And once I put my name to the pod, everything changed. Since then, I've continued to work in the patient advocacy space, and the Fertility Podcast has gone from strength to strength, so we thank you for your support. Kate joined me as co-host in 2019, and whilst I've loved every minute of making this for you, I love even more that you now have Kate at the helm as your host. Kate is an independent fertility nurse consultant, and you couldn't be in safer hands. I'm currently spending my days working hard with Fertility Matters at Work to help the workplace become more fertility friendly. For those of us trying to manage our jobs alongside trying to become parents, we're dedicated to helping you feel less alone. And if the Fertility Podcast has helped you in any way, please do take a moment once you've listened to hit the follow or subscribe button, and if you want to leave us a review, that would be amazing. Help us celebrate the 10th anniversary of the Fertility Podcast in style. Enjoy the show.
Are you considering PGT-A testing as part of your IVF journey? Hello, welcome to this episode of the Fertility Podcast. I hope you're all good and maybe at last enjoying a little bit of the sunshine that we have, which is pretty super. So a lot has been happening in the world of fertility and also in the world of Kate Davis, which I've got to report. So firstly, yesterday, last week, by the time this episode comes out, was mine and my husband's 25th wedding anniversary, our silver wedding anniversary. I actually shudder a bit when I say that because I don't know how I got to be so old. 25th wedding anniversary, silver wedding anniversary, that seemed to be reserved for people who just seemed ancient. Maybe I am ancient, I don't know. But whatever, we had a wonderful time, a lovely weekend in the Lake District with some wonderful people celebrating for the whole weekend. If you're watching this on YouTube, then you can see I've got some beautiful flowers behind me. So I've been very, very spoiled. But also some very exciting news about the Fertility Podcast. We are absolutely delighted to announce that the Fertility Podcast has been shortlisted in the Best Fertility Podcast category of the European Fertility Society Fertility Care Awards. And we are all so thrilled. It's been an honour to host this podcast for Natalie over the last few years. Initially, as you'll know, together, if you've been listening for a while, and then in the last 18 months on my own. But so much work goes behind the scenes. Natalie has been working hard as exec producer and giving me the guidance that I absolutely need. And then we have Ella, who's my intern, who is responsible for making the podcast sound good, for creating all the graphics and the YouTube videos and the videograms, and also Thea, who is Natalie's VA, who is so helpful in creating so much to do with the podcast and also for Natalie's podcast as well. So I'm so grateful for all the support that Natalie and I have from Ella and Thea. And so I'm so delighted. Even to get to the possibility of the shortlist is just an utter thrill for me. And it means so much to all of us. So watch this space and we will definitely let you know how we get on. But regardless, we're just utterly thrilled. Anyway, so in this episode, as I alluded to right at the very beginning, we're going to be talking about pre-implantation genetic testing, PGT-A for short. And I'm joined by someone who knows an awful lot about this. And this is Victoria Wigley, who is a clinical embryologist. And she's going to be sharing her wisdom with us. So if this is something that you're considering for your IVF journey, then listen in because I think you're going to find this useful. Let's get started and bring Victoria in. Hi, Victoria. Welcome to the Fertility Podcast.
Hello, thank you for having me on.
You're very welcome. It's great to have you. And this subject is one that I'm really excited to talk to you about, because I find it incredibly confusing, but also because I know a lot of people are asking about it. A lot of people are considering this option. So you're here as a clinical embryologist to talk to me about pre-genetic testing of embryos. So let's start from the very beginning. Can you explain all the different types and what happens in the process?
Yeah, absolutely. So it always used to be that when we would perform testing on embryos, it would be for patients who they had a family history of a condition, so perhaps something like cystic fibrosis, and they were doing the genetic testing to make sure that this didn't get passed down to their offspring. So that's how it all started. And then it developed onto what used to be called PGS, and it's now called PGT-A. So this is pre-implantation genetic testing for aneuploidy. So it's a bit of a mouthful, but that's what obviously it's referred to now. And in this, what we look at is we look at all the chromosomes within the cells. So the chromosomes it's not a specific sort of individual test. It's just looking at the numbers of chromosomes that we've got. So we should obviously have a set number. And in certain conditions, for instance, the common one that people know about is Down syndrome. And that's where you have 3 instead of 2 copies of chromosome 21. So the reason that we started doing PGT-A for some patients are we know that if patients are over 40, if they have a history of repeated IVF failures, or if they have a history of miscarriage, it could be that they are having more of these aneuploids, so abnormal chromosome number embryos. So by screening the embryos, it's another way for us to select the right embryos to transfer to the patient at that time.
Okay, so if a patient was going through IVF and they've got their real precious embryos and they're having a conversation with the doctor and the doctor suggests this, what happens then?
So for the patient purposes, all the initial part is exactly the same as a standard IVF cycle. So they go through the ovarian stimulation, they have the egg collection, we perform the insemination, so IVF or ICSI, and we grow the embryos up. So we grow them up until day 5 of development. And this is the point that it's slightly then different because the patients won't have an embryo transfer that cycle. What we'll do is on day 5 and or day 6, we perform the biopsies on the embryos at that stage. We send the cells off for genetic testing, and then those embryos get frozen. So they'll get frozen until we get the results. And depending on the genetic lab that's being used, usually it's around for 2 to 3 weeks to get the results. Once we then have the results, we can then determine which of the embryos in storage have the correct number of chromosomes, and therefore they'll be the ones that we'll consider for transfer.
And then presumably, if you're very delicately taking some genetic material from the embryo, then presumably there could be a risk to the embryo at that stage?
So it is, out of all the things we do in the lab, it is the most invasive because you're actually physically pulling a clump of cells away from the embryo. Now, when we do it at the blastocyst stage. So at this point, the embryo has outer cells, which go on and form things like the placenta, the amniotic sac, all that extra embryonic material. And then they also have a clump of inner cells, which is called the inner cell mass. And that part is the part that actually goes on and forms the baby. Now, when we're doing the testing, we only take the outer cells. So it's not affecting the cells that actually form the baby, but obviously it is still a risk that you might cause damage. Embryos are fairly hardy, so typically we don't see more than about 10% maximum that wouldn't survive. But obviously if you have a poorer quality embryo to start with, it is obviously at a higher chance that it might not survive.
Gotcha. Right. Yeah, that makes sense. And I have to admit, I've seen very few issues with patients, but I know that that's something that obviously as an embryologist you would have to counsel the patient about, that there is that risk. So we know that currently the HFEA, the Human Fertilization Embryology Association, they grade PGT-A testing as a red traffic light. So it's not something that has enough evidence to support its use and also carries a risk to the embryo, not to the patient, but to the embryo. So that's why it's graded as red. And therefore, you mentioned at the very beginning that it was always a test that we used to do when somebody had a family history and we wanted to establish whether there was any problems with the embryo. However, we're seeing that this is used quite routinely in clinical practice now, aren't we? What are your thoughts on that?
So I am actually quite passionate about this topic because on one hand, I very much believe in the technology. I very much believe in what you can offer to certain cohorts of patients that genuinely do really need this. But what I'm finding, and since I've set up my business, I'm seeing it more and more from patients either overseas or actually still in the UK who are being offered it when they genuinely don't need it. And obviously there are risks. And also financially, there is quite an impact as well. Mm-hmm. And so it's something that I do feel very strongly about, that patients need to be fully aware of everything that goes with it, the benefits of it, but also the risks that are involved, and also what it can mean for them and their cycle, which is something that often isn't fully explained to patients. So it is something that we do need to be very cautious about. And having said that, I'm not saying it's not got its place, because I very much believe it does. And certainly I've had some patients, one in particular that always stands to mind. A patient imported embryos to us because she'd had 7 back-to-back miscarriages, and she had lots and lots of embryos, but she couldn't do it anymore. And her current clinic didn't offer PGT-A. So she imported the embryos to us, and we were able to then screen them. First cycle, unfortunately, didn't work, but then the second cycle was successful, and she's now had a baby. So Great. Patients like her, that they are the kind of patients who, really would benefit from this. Having said that, I had one of my own patients, that I've been, since I set up All About Embryology, and she came to me, she'd had a baby naturally. She was 37 years old, hadn't had IVF before, no history of miscarriage, just it was taking a little bit longer to conceive the second. So I said to her, I didn't actually believe she should have IVF at all. But then when she said to me that her clinic said, oh, just have PGT-A as well, I mean, I was absolutely astounded. And the devastating part was the patient said to me, I just don't have the confidence to tell my clinic not to have it. And that was where I said, do you know what, I'm actually going to give you that confidence, because I am telling you, I don't think you even need IVF. I get why you want to do it, because, you're worrying that there's something going on. But then actually she then fell pregnant naturally before her cycle. So she didn't need IVF at all. But it was situations like that I just felt very saddened that patients are sometimes put in that position that they don't want to question what's being offered to them, because they might go and do their own research, but they don't have that sort of scientific background to be able to say, is this something that I genuinely actually need? So it is a bit worrying that it's being offered quite so routinely.
We are delighted that this episode of the Fertility Podcast is sponsored by our friends at One Day Tests. Whether you're thinking about starting a family or are already trying to conceive, getting a blood test can be a really powerful tool to support you on your fertility journey. And let's face it, we all know that it's a journey that can be fraught with challenges and uncertainty. However, doing a blood test is really straightforward, and everything you need is in the box. I've just done one. And it's so simple. You press the lancet firmly down on your fingertip and gently massage your finger to allow the drops of blood to collect in the collection tube. Then you pop it back in the post. It's so simple. And getting a blood test done with One Day Tests can really help shed a light on things that can affect your fertility, such as your egg reserve levels, hormone imbalances, and other possible issues, for example, PCOS. More importantly, fertility blood tests can give you the insight to what you need and can empower you to take the most impactful next steps in your fertility journey. It will really help you take the guesswork out.
One-day tests offer a large range of fertility-related blood tests for both men and women at really affordable prices. It's super flexible and can customise your test and have it done at one of their 9 clinic locations. Or if you're far away, don't worry, you can do it in the comfort of your own home using their home testing kits. Results are returned quickly with an easy to understand description, which you can access online and download to share with your healthcare practitioner. So to find out more, visit onedaytests.com, and you as a podcast listener can get a 10% discount by entering the code TFP10. So thank you to One Day Tests. They're really giving you the power to manage your health and your fertility.
Well, as you know, on the podcast, we're really, this is one of the things that we want to do is to give people the opportunity to learn, to have knowledge, to then be able to effectively advocate for themselves. I think it's so important. And I'm certainly seeing PGT-A offered really routinely, particularly for older women who have had implantation failure, women who have had recurrent miscarriage. And yeah, I'm with you on the whole, I just feel a little bit awkward about it. And I think that's where our position in consulting our patients comes in really handy, to be able to give that information and advocate.
Absolutely.
On that note,
and it's that independent advice, I think, that is the important thing, because we're not going to benefit whether they go ahead or not, but it's really empowering those patients with that knowledge to make the decision themselves.
A recent previous episode on the podcast has been about navigating a fertility journey and being able to kind of push through the treatments that might be offered to you, because let's face it, the fertility industry is a multi-billion-dollar industry, and who actually is the ones that are winning here, and it's not the fertility patients, it's the investors behind the fertility clinic. Anyway, that's listen to that episode if you're interested in understanding more about navigating the fertility industry and the darker side of fertility treatment. It's all in there. On that note, then, how much does it cost roughly? I don't know.
So it varies. I mean, it varies between clinics, but you could be easily adding another sort of 3,000 or 4,000 onto the cycle. It's something as well. Different clinics do it differently. So some charge per embryo, some charge, a set number of embryos, and then if you go over that, then you have to pay per embryo. So there is quite a lot of variability. But obviously, you've also got to factor in a frozen thaw cycle. So it might be that a patient just needs an IVF cycle to get them pregnant. But obviously now you're factoring the costs for the biopsy and the testing, and then a subsequent frozen thaw cycle. And all of that comes with extra medication, extra blood tests, all these things will add up. And if a patient doesn't need it, then they shouldn't be spending this money.
Absolutely, it escalates. I'm about to ask you another question, but I'm just going to do this with a little warning, because my cat has just come in the house. And for our wisdom, she has a cat bell, which is supposed to deter, clearly, birds, but it doesn't seem to work exactly. So if you hear a little jingling in the background, it's the cat bell. So the other question I've got is, and this is something that I've seen a couple of times with my patients, where they've had PGT-A testing. So yeah, even I can't say it, it's a blinking mouthful. They've had PGT-A testing and everything has come back okay, and they're really reassured. They go ahead and they have the transfer of this really precious, perfectly graded, beautiful embryo with no problems, and it doesn't work. I've had one where it didn't work, so implantation didn't occur, and sadly another lady where she miscarried. And the devastation that they both felt, because they had this huge assumption that despite, that the fact that this embryo was going to be fine, because there was no clinical reason why it wouldn't be fine. How do you counsel your patients with regard to that, so that they are aware that actually, even then, even with the wonderful science that we have, there's still going to be occasions when it doesn't work?
It's a really tricky one, because obviously we know that a lot of implantation failures and miscarriages are down to chromosome abnormalities, but there are a whole host of other causes that may not have been discussed or tested for. There are certain uterine issues. We know that more things like the immune side of things that can cause issues. There's a whole range of things that, unfortunately, a lot of emphasis is put on saying, let's get this perfect embryo. But also, you've got to consider as well that whilst I know that I said that we don't touch the inner cell mass, we don't touch the cells that form the baby.
Yeah.
Having said that, we are still taking out a clump of cells that are the cells that go on and form those connections with the uterine environment. So you need those cells to be quite strong. And as I said before, if you have a strong embryo to start with, chances are the biopsy won't affect it. But if the embryo is slightly weaker, especially in the tracheotomy cells, you could be potentially damaging the chances of that interaction with the uterus. And obviously that could then, even if you've got a perfectly euploid normal embryo, it might not be able to implant because the tracheotomy cells aren't strong enough to sort of set that initial establishment up. So there are lots of things to consider. And even I've said to patients before, as long, where they're feeling pressurized to do it or they don't know their decisions, I've said you don't need to decide until the day, because that is an important factor to have. They feel like they have to say, I'm going to do it or I'm not. But actually, as long as they're still taking progesterone, so that's the biggest thing. You've got to take the progesterone after the egg collection to make sure you're ready for a transfer. But really, they can decide based on the numbers that form blastocysts and also the quality of the blastocysts. So if, for instance, they've got, they started off with 8 and they were expecting a kind of 4 or 5 to form blastocysts, and on the day only 2 do, and the rest have sort of stopped growing, there isn't really any point in that patient going through the whole process of PGT-A testing. They really should at that point just do the transfer because they've got the front runners. They don't need an extra selection process to do. So it is something that I will often say to them, have the confidence to go and say to your clinic that, yes, you will be happy to do it if you get the numbers and if you get the quality, but you can pull out at any point and the clinic cannot pressurize you into going ahead.
Great. That's really good advice. Thank you. And I'm going to throw one more question at you.
Yeah,
toxins and egg quality. What's your thoughts?
So do you know, it's not an area that I know a huge amount about. But having said that, it is something that we are starting to learn a lot more about. Even things like, the supplements and all of that side. It used to historically be that doctors and embryologists would say, well, this is what we've got, you're destined, nothing can change it, nothing can make it better and nothing can make it worse. That is changing. So it is something that we do need to be aware of. I always do say to patients, though, not to get too obsessive about these kinds of things, though, because that can almost be counterproductive if they get themselves worked up about, not having exposure to something, or they've walked into a shop that has. It's absolutely impossible. And actually then the stress and anxiety and worry of potentially exposing themselves is actually worse than what it was they were trying to avoid. So I think it's something that certainly we need to keep an eye on the research and be sensible with our approach to preparation and when we're going down a fertility journey, and looking after our bodies and getting our bodies in the right optimal state, but doing that with still living your life and being a human being, because we can't avoid it all.
Absolutely. Living your life while you're trying to conceive. I think sometimes we forget about that, and that's so important to do as well.
Yeah.
Thank you, Victoria. That has been excuse me, there was a big bang above. My husband had just come home from the gym and I'd got in the shower, and I think he's just dropped something. So thank you so much, Victoria. That was brilliant advice. Really, really beneficial. And like I said, one thing that I pride ourselves on doing is giving this information and advice so people can make choices. So thank you so much. Where can our listeners find you?
So if you're wanting just to find out a little bit more about embryology and what we can kind of do in the lab and stuff, then find me on social media. So I'm on Facebook, Instagram, and TikTok, which I never thought I'd be on. And I've also set up a YouTube channel as well, so all the videos can kind of be concentrated in there. So the handles are at All About Embryology. Then I've got my website, which is www.allaboutembryology.co.uk. And you can see a little bit more about me on there. And if you'd like to book in for one-on-one consultations, whether you're in the UK or overseas, I can do these by phone or video link. So that's where you can book on via the website.
Fantastic. Thank you so much. And thank you again for being a guest on the podcast, because you have been with us before, and we'll link your previous episode as well. So thank you so much, Victoria.
Perfect.
That was brilliant hearing from Victoria. It's PGT-A is something that I find incredibly confusing anyway. So to actually hear it from her and to understand a bit more about it has been great. And I really hope that that's been useful for you. As I said, it's really important to us on the Fertility Podcast that we provide you with the information to help you make decisions. And if there's just something that you can take away from today and think, yeah, I want to ask my doctor about that, or I'm not sure about this, is this right for me? Or, oh yeah, no, that sounds absolutely right for me and I need to be considering PGT-A. I really hope that it's been useful for you. If you've got any questions, then please feel free to get in touch. I can always pass them on to Victoria as well. And as mentioned, you can find Victoria at All About Embryology, so don't hesitate in checking her out. If there are any subjects that you really want us to talk about more on the Fertility Podcast to help you make decisions on your fertility journey, or to understand more things about your fertility journey, then please do let me know, because hello. As you can see, if you're watching this on YouTube, you can just see that my cat has just joined us. But yeah, these are the type of things that I want to be doing more of. So just send us a message. You can find me on Instagram at Your Fertility Nurse, or you can email me on kate@yourfertilityjourney. Anyway, we're back in 2 weeks' time with another episode, so stay tuned. Bye for now.
Thank you for listening to this episode of the Fertility Podcast, which is brought to you by Nat Chat Productions. The music is composed by Parla, it's hosted by Kate Davis, and the episodes are put together by Ella Woodhouse and exec produced by me, Natalie Silverman. Before you click onto your next podcast, we'd love it if you could either click on the star ratings or write a quick review, as it's a brilliant way for others to know what you think, and even just hitting follow or subscribe really helps other people know it's worth a listen. Finally, just to say, you can follow the podcast on Insta at FertilityPoddy. Kate is at Your Fertility Nurse. And if you'd like to book in a consultation with Kate to understand more about your fertility and reproductive health, just visit yourfertilityjourney.com.